Welcome to Chapter 38, Part 1, Stressors of Hospitalization and Reactions of the Child and Family. Because children are extremely vulnerable to the stressors of these experiences, it's important for students to gain an understanding of their reactions to illness and hospitalizations. Effects of hospitalization on children can include effects that may be seen before admission, during hospitalization, or after discharge. The child's concept of the illness is more important than intellectual maturity in predicting anxiety, and the child may or may not be affected by previous hospitalizations. First, let's talk about age. Age can impact the reaction a child has to hospitalization. For instance, preschool children may see hospitalization as a punishment for behaviors that are perceived to be bad. The amount of preparation given prior to hospitalization can greatly impact a child's reaction to hospitalization. The amount of time between preparation and admission is dependent upon the age of the child. For younger children, it would be appropriate to wait until 1 to 2 days prior to an anticipated admission to prepare the child for the experience and related procedures. For children ages 4 to 7, a week prior to admission would be more beneficial, and then for older children, they may need to be prepared more than a week in advance. The security of home life can affect how a child reacts to hospitalization as well. A child that feels secure at home may not adjust well to admission, whereas a child who does not feel secure at home may. Previous experiences may have resulted in the development of positive or negative emotions regarding hospitalization. If an experience was negative for a child, he or she may perceive that all experiences will be negative and may react negatively to the admission. Support of family and medical personnel can help a child to have a positive experience. And the child's emotional health will also affect how the child reacts to hospitalization. Children who are hospitalized frequently and have experienced a greater number of traumatic procedures are more vulnerable to the emotional consequences of hospitalization. The major causes of stress are separation, pain, and fear. This is influenced by developmental age, early childhood. If separation can be avoided, children can withstand many other stressors. Late childhood and adolescence, family does not play as an important role as peers. It can also be influenced by maturity of the parents, cultural and economic background, religious background, past experiences, family size, and/or state of health on admission. Separation anxiety comes into 3 phases. The protest phase, they will have crying and screaming, clinging to the parent. They search for the parent. They have the stranger danger idea, fears nurses and refuses nurses caregivers. They attempt to escape. They may attempt to crawl out of a crib or leave the room. Physical force will attempt to hold on to parents to keep them with them, or they will push the nurses away. Despair phase. They will have cessation of crying, they'll have evidence of depression, they'll be inactive, and could be withdrawn. The risk factors that increase vulnerability to stressors are: they will have a difficult temperament. There will be a lack of fit between child and parent. One risk factor would be age, especially between 6 months and 5 years. Male gender. Below average intelligence. And multiple and continuing stressors like frequent hospitalizations. See the article Family and Child's Experience of Hospitalization. Now we're going to review some of the parents' reactions to a child's hospitalization. Parents often blame themselves for their child's hospitalization. They may feel guilty because they were not able to provide the care for the child at home. Parents may say things such as, "It's my fault because I was a month late getting their shots. If only I didn't work so much," or "If I didn't have to send them to daycare, they wouldn't get so sick." Parents' reactions to illness and hospitalization of their child can depend on one or more various factors. They may believe they are to blame for their child's illness because immunizations or well-child exams may have been neglected. Guilt, helplessness, and anxiety are often exhibited by parents during a child's hospitalization. In reality, parents are seldom the direct cause for the hospital admission. The nurse can help to reassure parents by listening carefully to a parental concern and acknowledging the legitimacy of their feelings. Nursing staff should always encourage and support parents and other family members and stress their importance in the child's recovery by encouraging them to participate in the child's care. Now let's review some of the factors that affect sibling reactions. It depends on the age of the sibling, who is staying at home to provide care for the well siblings, and a lack of information that regards their hospitalized sibling can affect the way a child reacts to their sibling's admission or illness. Also, the way that the children perceive the way a parent is treating them while their sibling is sick can affect the way they react. Siblings may feel as if they are being neglected while the parent is providing care to a sick sibling. And then parents are often unaware of the number of effects that siblings experience during a child's hospitalization. Common sibling reactions include jealousy, resentment, guilt, fear, worry, and anger. This concludes Part 1.